Hi, my name is Aaliyah Parker, and today I'm going to be performing my head, ears, eyes, nose, and throat test exam. And this is my patient, Mr. Parker. Can you state your name and date of birth for me?
Tony Parker, 2/12/72.
Thank you. And do I have your permission to assess you today?
Yes.
And I would ensure that my patient had privacy by being in a quiet, closed-off room. And I would begin by checking his general overall appearance, to make sure his skin's intact. What is the temperature of his skin? Are there any kind of lesions or abnormalities? The presentation of the patient in general. I'm going to move to asking him if I can run my hands through his hair. Would that be okay?
Yeah.
And by doing this, I'm going to gently tug to see if this hair comes out easily. And then while I'm doing it, I'm also going to go ahead and palpate his head, checking for any kind of lesions, nodules, or any scabs or anything unusual. And I do not feel anything. So after I've done that, I'll go ahead and ask him if I can examine his hands. And I'm going to check his fingers for any kind of clubbing while checking capillary refill. And all of that is good. You can put that hand down. And then I'll be taking note of the rest of his orbital features, checking for any kind of bruising or swelling that may be going on. While I'm doing that, I'm going to gently palpate the sinuses, asking if he has any kind of tenderness. Is that anything tender? Okay. And I'm going to palpate his temporal arteries one at a time. Good. Bilaterally. And I'm going to take the bell of my stethoscope and also auscultate the temporal arteries. Very good. I'm going to take this opportunity to check his trachea and his neck, see if it's midline. Would you put your head back a little bit? His trachea is midline, and I'm also taking note of his arteries and veins to check for any kind of distension or aortic pulsation, and that looks good. You can put your head back. I'm going to go behind him and go ahead and check his thyroid gland by placing my hands on the outside, asking if he has any tenderness while I gently palpate. Do you have any tenderness?
No.
I'm going to ask him to take a big swallow for me. Good. And I don't feel any kind of lesions or masses. Then I'm going to move to checking his lymph nodes, and I'm going to start with his preauricular. I'm checking for any tenderness or swollenness. His postauricular, his cervical chain, his deep cervical chain, his supraclavicular, his submental, occipital, his tonsillar, and I would do the same on the other side as well. And then I'm going to go ahead and do his ear examination, and for this I'm going to gently palpate his ears bilaterally. Do you have any tenderness or swelling?
No.
Okay, good. And I'm going to take my otoscope, and I'm going to identify his tympanic membrane, which should be intact and pearlish or pinkish gray. I'm also going to identify the incus, malleus, and pars tensa, making sure that the structures of his ears are intact. And I'll be looking for any kind of exudate or excessive wax. Those look good, thank you. Then I'm going to move on to checking his nose, and I'm going to gently palpate the sides, checking for the septum to be midline and have continuity. Do you have any tenderness?
No.
All right, and I'm going to go ahead and look in your nose. You can put your head back a little bit. And when I look in his nose, I want to make sure that it's moist. I'm going to look bilaterally, looking for any deviation, and checking to see if there's any kind of masses or lesions. And there's not. They look good. Now you can open your eyes and put your head forward. I'm going to change over to my ophthalmoscope. And with this, I'm going to do his eye exam. The first thing that I'm going to be checking for is direct and consensual response. To do this, one more thing I was going to do on his ears. I'd like to check his hearing. So I'm going to have him cover his left ear with his left hand. And I'm going to whisper something and ask him to repeat it. Repeat what I say. 99.
99.
And I'll be about 12 inches behind him, and I'll do the other side. Repeat what I say. 99.
99.
Good. That's intact. Now to check for consensual or direct response, I'm going to go ahead and cover his right eye and ask him to open up his left eye. And then I'm going to check for constriction as I put the light in the eye, and it does. And I'll do the other side. Keep your eye open. Now I'm going to have you keep both your eyes wide open. I'm going to help you out. And I want to make sure that when I shine the light in the right side, the left constricts and vice versa. Checking for consensual response. Good. Now I'm going to move to doing his red reflex exam. And for that, I'm going to get my light over the circumference of his eyes. And I'm going to adjust my ophthalmoscope scope. Make sure the camera can see me until I have a good clear picture of his eyes. And what I'm looking for is a general red color throughout. And what this will indicate is if there's any kind of corneal scraping or malignancy, then you would see the coloring changes in one of the eyes, to which I do not see. Now I'm going to move back to my other light because it's easier to use. And I'm going to be checking his mouth. And to do this, I'm going to ask you to go ahead and give me a big smile with your teeth. Open your mouth, keep your teeth showing. Good. And I'm checking his overall dental hygiene. I'm checking to see how many of his teeth he still has, the condition of them, and I was also checking the symmetry of his mouth. I'm checking his lips for any kind of dryness or cracking, making sure that they come up equally. And then I'm going to ask you to open your mouth again and lift your tongue. Good. I'll be checking the bottom of his mouth for his moistness, any lesions, masses, and making sure that his arteries and veins are intact that should be there. And then I'll ask you to stick out your tongue. And I'm checking for coloring and to make sure that the tongue is midline. And that concludes my head, ears, eyes, nose, and throat exam. Thank you.